It's extremely important to decrease stress in our lives because I think it will relate to a number of things. We know that people that have stress have more problems with their heart, and ultimately your health is worse if you have a very stressful lifestyle. Hi, my name is Dr. Camille LeBrecque, and I've been a gynecologic oncologist practicing in my own practice in Las Vegas at Falkner Gynecologic Cancer Care since 2010. So usually I will have patients that come to see me and they always want to know what can they do to prevent getting abnormalities, cancers, precancers of the pelvic gynecologic organs. And those are the organs that I take care of. And so I say, well, actually, there are very direct things that you can do to prevent from having problems. And the first thing you can do in order to prevent cervical cancer is basically to get pap smears. And pap smears, although no one likes to come and get them, they are extremely important, and I think, honestly, one of the best sort of inventions in medicine for screening. As a woman, you go to the office, you get a pap smear, your doctor scrapes cells off of the cervix, and then they send those cells to the lab, and they can determine if those cells are normal or if they're precancer. And precancers are not dangerous to us, but we can't feel them, they don't cause pain, they don't cause bleeding. But over time, and usually it's 5 years, in most cases 10, 15, or 20 years, those precancerous cells can become cancer. So it's this great test that if we find that you have precancerous cells of a certain level, then basically we take you, we do an outpatient surgery, and then you don't have to worry about developing cervical cancer. Actually, the things that we find that are most likely to cause cervical cancer or precancerous cells are if you have exposure to the human papillomavirus. And so we know that the more sexual partners you have, the greater chance of getting that virus. We also know that smoking also contributes to precancerous cells on the cervix, and we're not exactly sure why that is, but probably because we think it decreases your immune system, and in that way it lets your body more able to develop these precancerous cells. We know that for endometrial cancer, or cancer of the uterus, that's the most common cancer of the uterus, that having a normal body weight is the best way to prevent that cancer. Women who are obese or overweight have up to a 30 times greater chance of getting that cancer during their lifetime. Of course, it's easier said than done to say keep a normal body weight, and people will tell you this for everything, for, to decrease chance of diabetes or heart problems. But for me, I tell my patients, because you specifically will decrease your chances of getting endometrial cancer with a normal body weight. It's really hard to do, I think, especially for women, because of the fact that we're so busy, we're running around, we're taking care of our children, taking care of husbands, but ultimately it's something that really needs to be a priority. And unfortunately, it's hard for a lot of us to even have time to cook at home, but the things that would help keep your body weight normal would be, number one, trying to eat usually certain things and trying to avoid certain things most of the time, and that would be sugar, I think, mainly. Other things that help with keeping a normal body weight is doing some sort of exercise, and I'm not talking about really intensive exercise, but some sort of movement, like 5 or 6 days a week. Very important, whether it's walking or yoga or anything that's just a movement. Dancing is very important. And then thirdly, I think sleeping is really important for all of us. And we don't talk about it as much, but we know that people who get a normal amount of sleep, and for most people that ends up being 7 to 9 hours a night, then you're more likely to have a normal body weight. Most of the data that we find shows that people who are obese are more likely to sleep less or have sleep that is not as quality as people who have a normal body weight. Now, I think that stress is one of the biggest issues, at least that my patients will come talk to me about. Everyone comes, they're coming to get a pap smear or an exam, but most of my patients have a lot of issues that are related to the stress that's in their lives. So if you're very stressed, it becomes difficult, I think, to eat correctly. We also know that stress tends to make us want to eat the wrong things, and this has been proven. So if you're under stress, you want things that are sugary or processed because these things make us feel better. So It's extremely important to decrease stress in our lives because I think it will relate to a number of things. We know that people that have stress have more problems with their heart, and ultimately your health is worse if you have a very stressful lifestyle. So certainly decreasing stress has to be a priority. I think certainly for women, once they get to be a certain age, where they have more responsibilities, taking care of children, taking care of their husbands, taking care of other friends or family members, and of course working. I really, until probably the past 6 to 8 months, had not really thought much about this. But because I will be turning 50 next year, I thought, oh my goodness, I'd better try to figure this out because I wasn't feeling as well anymore. So I actually have evaluated some different ways to fight stress. And so for me, it involves walking every morning or almost every morning. It involves jumping on a trampoline every morning. It involves trying some other activities like going to infrared sauna, doing cryotherapy. These are all things that I had never even heard of a year ago, but I started sort of my own self kind of evaluation of things. And then with that, I've passed it on to my patients. I've also really, for me, made it a big point to try to think of ways that in the future I'm going to have a less stressful lifestyle. And some of that has been sort of adjusting my work schedule or thinking about what I want to do professionally in order to decrease the stress in my life.